this is Selma Schimmel in Las Vegas at the Community Oncology Alliance meeting, and I'm now joined by Susanne Johnson-Burns. Susanne, I understand that you are an advocate, you are a caregiver, you are also, in particular, the first state chair for COA's Patient Advocacy Network. So your life experience seems to complement what you're doing with COA in a unique way.
It does, and I was here last year for the conference and took away so much knowledge. I learned just a tremendous amount and felt like I needed to take that knowledge further. I didn't just want to sit on it, so to say, so I went back to my state of Georgia and said, what can I do with all this information that I learned about the struggles cancer is facing, the crisis. Cancer is in crisis. And I think something else I realized was that for our legislators or decision makers when it comes to Congress or on a federal level, they missed the point that cancer is a face, it's a person. And it was my mother and my father who just very recently passed away from cancer as well. And then I asked myself the question, where am I going to go when I need care? And I think that's the big picture now for me, is that that's what's in jeopardy. Where am I going to go when it's my turn? Because I have such a strong family history. And then working at the Northwest Georgia Oncology Centers in Georgia, it's a big oncology practice, we see that face of cancer every day. And that's the message I want to bring out. And that's why I've started to meet with our House representatives in Georgia, our senators. I'm trying to get more patients interested to be advocates, to get them involved, to lose their fear of speaking in public or thinking that people don't really care or don't want to hear it, because they do want to hear, and I think it's up to us to really stand up and have our voices heard.
A patient who's listening to you now who says, I'd like to get more involved, how would they do that?
They can certainly start by looking at the COA website and the patient advocacy track that's attached to the COA website. Gives stories. There are many stories from patients that have put their stories on the websites that talk about their feelings. There's of course the contact information for Rose Gerber, who is the president of the program. She does a wonderful job. She's a survivor herself, so she's definitely someone that's reachable, that will answer any questions anyone might have. And then really just if you have that passion in you that says, wow, I want to do something, I can do something, I want everyone to know that they can. And it may be in limits. They may not be able to travel to Las Vegas or to Washington, but there is so much opportunity right there in their own community.
Susanne, when you mentioned that you lost both your mother and father to cancer and your own risk, what scares you the most?
Not having that community oncology clinic to go to. The nurse that knows me, where I can feel at home. I'm in some place
safe.
If I'm having to deal with a devastating illness, to feel like I have hope and I have a chance to live. And to be treated not like I'm just one out of thousands, but to be that one important person.
I think your final statement sums it up in a really important way. Thank you, Susanne Johnson-Burns, caregiver. Someone might call you a pre-survivor because you live with such a huge anticipation of a disease which I hope you don't have to face, but will be able to continue to help and support others. The first chair for COA of the Patient Advocacy Network. Thank you very much.
Thank you very much.